There's nothing to fear about this. People fear fear itself, and ignorance breeds fear. So they should just be straight with the people of Australia. Singapore is straight with its people. There's a WhatsApp group, and you get a WhatsApp message twice a day telling you exactly what's happening and what the problems are. We should just trust the Australian public to have the information so that you can actually share the pain of some of these difficult decisions. I think there should be a travel ban. One of the reasons we've done well so far in Australia has been because of the travel ban from China, and then laterally Italy, Iran, South Korea are being careful at least about these places. And it's out of control in the United States. There are tens of thousands of cases. They don't even know how many they've got. And we should institute a travel ban. And I suspect the reason we've not is politics. The mathematical modelling is clear. There's really only one thing that controls this epidemic, and that's social distancing, controlling people coming together. And the question is how long you wait. The current policy of the Australian government is to wait until the numbers show that you need to do it. The trouble is we've now got exponential growth, albeit from low numbers. So I think we should be much more aggressive early and not wait for those numbers to grow. The school situation is really not easy. The evidence from overseas, from China, from Singapore and Hong Kong, is that they've managed to control it without closing schools. The trouble is that in those places there were school holidays around the time the epidemic started. So it's not really a valid comparison. And children do get SARS-CoV-2, and they'll probably spread it because they do with influenza. So it's a really difficult decision, and there are societal impacts from closing schools. The Prime Minister is right. Not an easy decision. Maybe you wait a week for that, but probably the right thing to do is close schools now. It's not far from Easter, and maybe they have a month-long holiday. It's tough, but I think we control this epidemic early rather than waiting till the numbers get out of hand. The numbers today are what happened in Australia 10 or 14 days ago. And what happened over the weekend with football matches and basketball in WA is what's going to happen 10 to 14 days from now. What we do now will not see the effects for a while. So you press the button and it's slow action at the other end. I do think that a severe shutdown is required. And it may not be for quite as long as we need because we'll get on top of it more quickly. But now's the time to do it when we've got small numbers. The worst thing that can happen is that 6 weeks from now the shock jocks say, see, told you nothing would happen. Well, when prevention works you don't see it, and that would be a great success. I'll cop it from them. China has very sophisticated testing, including CAT scanning, mobile CAT scanning, to see if you've got the signs of COVID-19 in your lungs. But it's also, once you've got a case, you're plucked out of your family, you're quarantined. We are doing that. Then very active contact tracing. The question is, do you just contact trace for 24 hours back or 48 hours back? Because the logistics of that become quite large. And that's another reason why you don't have mass gatherings, because you can't contact trace from a football game with 40,000 people or a basketball game with 14,000. So contact tracing, it's old-fashioned epidemiology, but it works. And the other thing they're doing is if they've got a cluster in a suburb or an area of the city, they shut it down and they go in there and they really look hard for cases. So it's case finding as well. It's just obsessive, compulsive, old-fashioned epidemiology. But, Hong Kong's got a reasonable sized population and they've got a mainland population as well. So it's true, it's smaller and it's always easier when it's smaller. But the fact is we are actually doing a lot of that already. But are we doing testing widely enough? Are we isolating areas of Sydney and Melbourne and really going in there? Are we sharing the information with the public so the public is aware of where the high-risk areas are? We're not doing all of that, and we could be doing more, and particularly our testing clinics need better resourcing. The question of when you're infectious is a little bit contentious. It turns out there's no such thing probably as a completely asymptomatic person, that everybody gets symptoms at some point. And the average incubation period is about 5 days. And during that 5 days, the amount of virus in your body slowly grows and it gets pretty big when you get the symptoms. But you are infectious before the symptoms come out. There's no question about that. And the WHO tends to think about 48 hours. In Australia, we're saying 24 hours. But between 2 days or so before your symptoms come out, you're infectious. But you don't know when your symptoms are going to come out because When you're isolated for 14 days, even if you quarantine for 14 days or isolated for 14 days, 1 in 1,000 people will still get the disease because they've got a longer incubation period. So there's a lot of variability, but no question that you're infectious before the symptoms come out, but wide variation. First thing here is personal responsibility. If you've got a cough or a cold, you don't go to work. You probably should wear a mask if you've got a cough and a cold to protect other people. Everybody should be washing their hands. So you should be not going on public transport if you've got those symptoms. If you are on public transport, hopefully more and more people are staying at home, so it's dilute and there aren't many people there. Surfaces are a risk. So if you touch a surface and other people have passed by with the infection, then you could pick it up from the surface. So surfaces have got to be avoided if at all possible, hard on a rocking train or bus. And the other thing here is that you don't catch COVID-19 or the virus that causes it by just breathing in air. You've actually got to get the droplets, so close contact. That's why healthcare workers are very high risk. It's close contact with the droplets, or the droplets have gone on surface and you've picked them up from that and you've touched your face and it's on your hands. And it also may well be that food might be able to be infected by SARS-CoV-2. That's controversial. So just prudent, watch surfaces. Just walking through an area where somebody else has it does not necessarily mean that you'll get it because it doesn't pass through the air in that way. If you test positive at the moment for SARS-CoV-2, in most states in Australia, you are then plucked out and put into hospital, into quarantine. And in some parts of Australia, particularly in Sydney, in some places where you've got a lot of homeless people, and there's suspicion of a contact rather than necessarily positive, they're finding places for these people to stay so that they are isolated and away, and so they're being looked after properly. But if you test positive, you've got to be quarantined, and you've got to be quarantined for a period of time. Nobody really knows how long, because the virus can stay in your body for quite some time, and that's the unknown factor or the less known factor at the moment. You just need to hear the reports coming from China and Italy to know that there's a bit of mythology here, and I've been guilty of promoting this mythology, which is, everybody's seen the graph that after the age of 60 or 70, the graph goes up in terms of mortality rate, or what's called case fatality rate, up to about 15% at aged 80 if you've got heart disease or diabetes. It turns out that there are plenty of people dying in their 30s and 40s in Italy and China. This is a disease which also affects young people. And those young people have no obvious risk factors for serious disease or death. They've not got heart disease, they've not got diabetes. It's actually quite scary. And you're getting these heart-rending stories, particularly from Italy, where if you're 60 years old, you're put in the corner to die, because the intensive care beds are filled with 30 and 40-year-olds. These are terrible decisions to ask doctors to make. The balance here is difficult. The individual risk is still low. The number of people who are actually going to get seriously ill is still only a small subset of everybody who's infected. But there is that risk, and it tends to be random of who's going to become seriously ill. And what this should do is actually prompt us through a healthy degree of anxiety to change our behaviour, wash our hands, not go into public, avoid going into work when we can, avoid using public transport, and not having large events of anything near 500, so that we're minimising our chances of catching it ourselves, and more importantly, catching it ourselves and passing it on to somebody who might have cancer or have had an organ transplant who might die because you passed it on.